Welcome and welcome again to this channel. My name is Akia, and if you're on this channel, it means you are either interested in pursuing nursing or you know someone who has an interest in pursuing nursing. Welcome once again. Now, nursing is a very good profession. Let me start from there. It's a profession because we who work there, we are professionals. Yes, so a nurse is a professional, just like a doctor, like a lawyer. Name it, anything that you think is professional. Yes, nursing is also a professional job or a career, if you call it so. Now, what do you need to know before getting into nursing? There are 5 things that I think that everybody who wants to pursue nursing should know. 5 basic things before you enroll into nursing school. Now, before I go into those 5 things, let's explain the various categories in nursing. So, I'm in Ghana. So in Ghana, we have the general nurses, we have midwives, we have psychiatric nurses, we have community nurses, we have public health nurses. I'm sure there are other forms like certificates. Yeah, so if anybody has any other categories that I didn't mention, you can drop it in the comment section below. Now, the differences are clear in the categories. For example, general nurses, they mostly work in these fields. We have OPD. You find some of them on the various wards, male ward, female ward. We also have midwives. Midwives are particularly focused on pregnant women, during pregnancy, during labor, and also after labor. So you find midwives there. And psychiatric nurses obviously work in the psychiatric facilities. We have community and public health nurses. These ones mostly go into the field. They are mostly in the public areas. They go into the communities to educate and also prevent diseases. So we've mentioned all the various forms. As I said, there may be some forms that I didn't mention. If you know any, please drop it in the comment section below. Now, the first thing you need to know before getting into nursing is that passion is never enough. What do I mean? Well, there are many people who get into nursing because when you ask them, they'll tell you, oh, I like taking care of the sick. I like helping the sick. I want to help people. Well, those are noble reasons for getting into nursing. But believe me, you need many other qualities to be able to be successful in this field. 1, you need empathy. And you also need a strong mindset to get into this field. Empathy means, like, for example, the passion that I mentioned earlier. For you to have that passion, you need empathy. In addition to it, you need to know how to have empathy on people. You need to know how to put yourself into people's shoes in order to take care of them properly. Now, I mentioned a strong mindset. Yes, it's very important because the nursing field is a very busy field. Both the nursing, midwifery, psychiatry, every field. Because there might be some of the days that the places are going to be very choked. Some patients are going to be very rude. You need to have a strong mindset in order to be able to be successful in this field. Apart from the patients being rude, believe me, some colleagues are also very rude. The colleagues, some are rude. The bosses, the in charges, as we call them, some are very rude. They might speak to you anyhow in front of the patients. You need to be strong-willed and have a strong conviction that you want to do this before you get into it. So that is one. Passion is never enough. Number 2, there are levels in this field. What do I mean by levels? Well, it's like a hierarchy. A hierarchy is you start from the bottom to the highest, or from the highest to the lowest, whichever way you have it. So in nursing, we have students. we have rotation, we have the staff. Now, in all these three aspects, there are also subcategories. For example, with the students, we have community health nurses students, we also have diploma students, we have the degree students. So these are the various forms of the students. So when you get into a hospital, not everybody you see there is a staff. You might encounter some students, and the students too, there are different parts. As I said, you'll find either community, diploma, degree, also there are certificate nurses around. Another part is the rotation. Now, what are rotation? Well, in the corporate field and other fields, these are called national service personnel. But when you come into the hospital, the nursing field, we call them rotation nurses. Why do we call them rotation nurses? Basically because, the hospital has different, how do I mention it? Different sectors or different parts of it. Let me say it that way. And when you are doing your national service as a nurse, there are certain things that you have to make sure you get a little bit on. So you cannot do your whole 1 year in a particular ward or a particular part of the hospital. You have to rotate through all the hospital. So you go through the emergency field, you go to OPD, you go to the various wards, let's say male ward, female ward, pediatric ward. If you're a midwife, you spend most times in the labor wards and stuff. I think I'm getting too much into it. This will be for the rotation nurses. So this video is basically for people who want to get into nursing. So as I said, there are students, there are rotation, and now there are staff. So the staff are those who are permanently employed in the hospital. And even the staffs, there is the hierarchy. Okay, you realize the nurses, some are wearing all different shades of belts, some are in all different colors of uniforms, brown, green, white, and then green belt, white belt, it's many. So you need to know that there are levels in the field. Third thing you need to know is that try and expose yourself to the profession before getting into school. What do I mean by this? Well, you try and find a facility nearby that you want to get your hand on some of the basic things about the profession before enrolling into school. Why is this necessary? There are many people who have gone into school, did their first set of clinicals, and then backed off. You ask them why, they'll tell you, oh, I didn't think nursing was like this. I thought it was cool. It is hard. Well, it is hard. It is not easy. That is why before you get your head into the profession, try and get a facility close to you. Mostly I recommend a bigger facility, but the big facilities, the possibility of them accepting you is very low. So try and see maybe some polyclinics, some, regional hospitals. Well, teaching hospitals, no. The possibility of you being accepted is very low. So try and get into these facilities, the smaller ones, and tell them that you are interested in pursuing nursing, but you want to get your hand on one or two things. The reason why this is important is because at least before you get to school, you know some things that you need to expect. And you also know, as I mentioned earlier, that passion is not enough because you'll be exposed to certain gruesome things. And this period that you give yourself will help you to know whether you want further getting into the school or you want to quit. Because there are many people who have done a whole year, paid the school fees, bought the books, and then they dropped out. Yeah, so try and get your hand, on one or two things. Be exposed to the nursing environment, how the nurses relate to each other. Expose yourself a month or two before enrolling into nursing school. Now, the fourth thing is that this is a very important point. Nursing is not all about carrying out procedures. Now, let me repeat myself. It is not all about carrying out procedures. Procedures is one major field in nursing, but mostly what happens is that when students get into nursing school, one misconception they have is that the moment they start, they're going to be taught how to inject. For the midwives, they think, oh, the moment they start, they're going to be taught how to deliver pregnant women, how to do all these big procedures. No, it doesn't work that way. Why do I say this? There are certain procedures that before you be able to do, you need to understand the human anatomy well. So in getting into nursing school, believe me, before you be able to do any procedure, you have to learn about the human body. That's not the only thing you need to learn. You need to learn other things such as communication. Yes, communication is very important because the people you are working with, they are human beings. Your colleagues are human beings, the patients are human beings. So you need to learn how to communicate properly. We call this therapeutic communication. This is very important because people mostly complain that nurses are rude, nurses don't know how to talk. So this is a very important part of the nursing school that you have to take into consideration. So it's not all about the procedures. Another thing that you have to learn before getting into the hospitals is psychology. Now, what do I mean by psychology? With psychology, you learn about human behaviors. As humans, we all come from different homes. We all have gone through different experiences, so we all react to things in different ways. So some of the things you learn in school is human psychology. There are some people who are very outgoing, some that are very withdrawn, some a combination of both. Some have gone through certain traumas that have shaped them into a particular personality. You have to learn all these things before getting on the ward. So that is the fourth point that you need to consider. So what about the last point? The last point is basically a follow-up to the fourth point. So with this one, it is that some of the procedures you would not be able to even get your hand on them until later years. Yes, there are some nurses that there are some procedures that they are only able to do during their rotation or during the national service. So as a student, don't rush. Just take time, study about the the human body. So study about the human body, human behaviors, how to communicate. You learn so many things from there, and then later on in your career or in your profession, you'll be adding on knowledge. So it shouldn't be all about, you want to learn how to set a line, you want to learn how to deliver a woman. No, you need to learn the various parts of the human body before you learn how to carry out certain procedures. So basically, these are some 5 basic things that I think that you have to know before enrolling into nursing school. And the part that I would like to emphasize more on is the part which said that expose yourself to the profession before you get into it, so that you do not drop out while in session. So these are the basic 5 points. If there are any questions that you want to ask, please drop it in the comment section below. Give the video a like and subscribe. Thank you. If there are any questions you have, you can also drop it and I'll make a video on it, or I'll give you an answer to it. Bye bye.